We're joined by the co-founder of the Action Health Incorporated, Uwem Uko Esiet. Good morning and good to have you. We'll be discussing the IDPs with you very shortly.
All right, I'd like to take you to my world to give us a perspective to understanding the basics. Let's attempt some statistics and critical look at the issue of internally displaced people. Now, Nigeria has at least 3 million people who are internally displaced by conflict, making it the highest number in Africa. Now, if we move ahead to see a better perspective, now Nigeria, but on the global scale, Nigeria is only ranked behind Syria, which has about 6.5 million people who are internally displaced, and Colombia, which is ranked, which has about 5.7 million people, making Nigeria the third country when it comes to the ranking of people who have the highest number of people who are internally displaced. If we move on now, of the global total figure of IDPs in Nigeria, at least 12.6% of them were displaced due to a communal clash, and we have that graph representing it, and we have about 2.4% that are displaced based on natural disasters, and then 85% of them displaced based on the activities by or attacks by the so-called Islamist group Boko Haram. Now, if we move on to have a better understanding, now many of these IDP camps are located in 207 local government areas spread across about 13 states in northern Nigeria. And the camps are located in Abuja. Abuja has about 13,000 IDPs. Adamawa State has about 136,000. Bauchi State has about 70,000. Benue State has 85,000 IDPs. Borno State has more than 1.5 million IDPs, and Gombe State has 25,000. Kaduna State has 36,000. Kano State has 9,000. Nasarawa State has 37,000. Plateau State has 77,000. Taraba State 50,000. Yobe State 131,000, and Zamfara State 44,000. That's the spread of the makeup of internally displaced people. Now, as the increased number of Boko Haram attacks, heavy-handed counterinsurgency operations, and ongoing intercommunal violence gave the number of IDPs an unprecedented rise year by year, and the increasing deadly attacks on border communities and the destruction of properties, businesses, and farmlands have forced many inhabitants to flee to nearby towns and villages, as well as into neighboring Cameroon and Chad and even Niger Republic generally. Now, according to the National Emergency Management Agency, about 68% of internally displaced persons in Nigeria were children. And the agency also said that more than 410 babies were delivered in some of these camps, born in the space of 2 months in the camps for people displaced by Boko Haram insurgency in Borno and Adamawa states between August and September. Now, in the same period, there were about 187 marriages during this period in the camps, and 100 of them were in Maiduguri camp, and 87 marriages consummated in camps in Adamawa State. But the plight of these people still remains a major concern to many Nigerians, and certainly it is something that people have certainly shown concern for. Let me come to Uwem here right now. If I have to ask this now, how bad is the state of the plight of IDPs generally? If you can give us a picture.
Okay, the truth of the matter is Nigeria has not learned over the years from the communal clashes and the internally displaced persons. We do not have a national center that I can speak to in this nation that can give us a complete narrative of what has happened to internally displaced persons. And therefore, we are not studying that phenomenon, and therefore our response in itself is weak, is ad hoc, and our sense of anticipation. Remember that camps are not like NYSC camps. These are migrants, people who have to leave their place suddenly, forcefully, for one reason or the other. And what should we be looking at? You'll be looking at a lot of things. You raised a very critical issue, and you must agree that this is the problem. Nigeria is not even consciously realizing that we must invest in our future. The future of Nigeria are those 35 years and below who define what this nation is. They make up 65% of our population. And if you go to the IDP camps, who are the most vulnerable? The men oftentimes are not available because either they're involved in insurgency or communal clashes, and therefore they have been killed or they are busy killing themselves. So you find women, children, and the aged. So what are we doing for this subpopulation? I mean, you saw the figures for children in the camps. When you have children in the camps, they don't want to just have shelter and food, they want to have their life course being replayed. If I was in school, I need to get back to school. I need food, I need dresses, I need playground, I need a sense of identity, I need my cultural identity, I need my faith identity. So a lot of things are needed, and all of these things are not there. You hear women and men are getting married. Where men and women are, for crying out loud. Their sexual and reproductive health must come to the forefront. You begin to try to rebuild your life, get emotional support. You understand? And the truth of the matter is these are natural phenomena of human beings endeavoring to relate to each other. But when they come into camp, we must recognize that it takes a minimum of 10 years for people to be able to rebuild their lives. And therefore, we must have a 10-year plan per person. Not just for that community, per person.
And that really is really huge, enormous. I mean, when you say that the Nigerian government has not learned from the past, are you saying we really realistically could have been better prepared for this avalanche or onslaught of IDPs, internally displaced persons, all across Nigeria, especially in the north? Could we have been more proactive?
We could have been everywhere. And that is the beauty of learning from an experience. And you learn from both your successes and your failures. What did we do right? What didn't we do right? How can we be more cost effective? How can we reach each person? Listen, humanitarian response is not a new science, and it's not rocket science. People have been displaced in the Middle East, people have been displaced worldwide. So it is the same human beings who are displaced. And you can see what has happened in Europe, for instance. People have moved massively across oceans, across using every unimaginable means to get to where they are going to, and saying we have a right to live, and we want to live. We don't want to remain where we are going to die, or we will not fulfill our life courses. So for Nigeria, communal clashes have been there, for crying out loud. Benue, Nasarawa, Kogi, name it, Bakassi. I mean, there's a resurgence around Bakassi that, oh, you didn't do enough for us now. Do you understand? And it's because there is no center. Once you learn from it, you improve the next time. What are the things that we must get into a place? I see all the time they bring food, they bring mats, some mattresses. Open defecation happens. Water supply. These are things people need. People have fought wars in the desert. So we can learn from other climes. And like I was listening to all the other presentations, we need help. We don't know it all. Nigerian government, NUC, whoever, somebody must just start a center for emergency response where knowledge will be shared. Let us chronicle how many of these clashes have we had? How many camps? What happened to the history of each camp? When did they start? When did they fold up? Do we still have people who have been in camps for 20 years? Why are they there? Why couldn't we rehabilitate them? You understand? It's not about whether it's northeast today or northwest tomorrow or south tomorrow, because these problems will remain with us, because any community where you have human beings, they must fight.
Indeed.
Okay, well, when you talk about, you said we need help, generally. If we have to break down this help, is it going to be more in the area of technical capability or in the area of resources?
I will approach this from 2 points. The first resource you need is knowledge to prepare. Don't wait until it happens. Have a team that says, look, if this happens, we can deploy. How many psychosocial counselors do we have that are ready? I was part of the initial meetings in Abuja, anticipating if things get going in the Boko Haram areas, what will happen? And in those initial days, we had to immediately bring UNFPA into the first meeting, and it was hosted by Idps, an NGO that works on women's health. That was where we had the first meeting. And I remember that the executive director of UNFPA even phoned in from New York to encourage us, because we were thinking from all angles. What do you do? Who needs what? There will be pregnant women who are rushing. Who will deliver those women? There are children who are coming who have not eaten. What do we do? So it was a multi-agency, several NGOs, and then we did not at that immediate time start talking to the military, because we needed to have something to say, these are the things we need to prepare. But remember also that there's still a government institution, NEMA.
Exactly, you took it right out of my mouth. I just penned it down now. NEMA, National Emergency Management Agency, isn't that within their purview? Isn't this what they are really supposed to be doing?
You see, NEMA appears to me like a response, and this response team that you see from NEMA comes with a lot of publicity and media. What we are saying is beyond the facade of publicity. Is what do you do in a situation and which we don't really have enough knowledge on the ground. Emergencies occur everywhere, even in this studio as we are now. If there is an emergency, what do we do? In the larger community where we are situated, what do we do? In this state, somebody must ask, suppose for one day the third mainland bridge collapses, what happens? You don't wait until it collapses. So that once it's about to happen or it has happened, you just activate everything. And that is what we don't have. Sometimes we can't even get to the place because nobody knows the geography. I mean, we've seen bridges
just
collapse.
The thought of what you just said is
I
mean, it's really scary.
So for me,
So these preparations would actually mitigate the impact that it would have had, if...
That's it. And we must have a serious core of volunteers because human resources is key. Can Nigeria mobilize 200,000 women, men, young people who you can deploy to an area? You've seen landslides, mudslides, and I keep telling people, we shouldn't have typhoon, we shouldn't have those things. If we have them, nothing. Even building collapsing here, a building has collapsed, you go and bring a crane on the building to bring out people and to killing more people. Can you even detect life? You need something to put there to say, are people talking? Are we picking voices? Where are we picking voices? Even if we want to remove slabs. So for me, the knowledge gap is too much. We need help.
Okay. Now, another area we're going to talk about now is the issue of the illegal IDP camps, as the case is, but certainly we'll come to that. Now, more than 500 internally displaced persons living in a riverine community in Lagos are currently in a pitiable state.
They want government to pay greater attention to the needs of the vulnerable in society. But the drama in this story is about the validity of the IDP camp, which the Lagos state government is yet to ascertain. Now,
Abimbola Agbebi has that story.
Among them are children. They all fled their homes to seek refuge in Debojo, a riverine community in the Bejuleki area of Lagos. The Boko Haram attacks in Damboa, Chibok and Askira in Borno State have taken thousands of them away from their land. Many of these internally displaced persons somehow found their ways into Lagos and had since been provided succor by non-government organizations.
At a point, they were all scattered around Lagos, and all that. So as an association, we now look at it, and said, the only thing we can do is to look for an area that is more affordable.
Ramotalahi and Gambo both share their stories on the particular attacks that made them to flee their homes. Gambo, like other IDPs here, had looked forward to a new life here.
They were burning our homes. We had to run for our dear lives.
In Chiba local government is that
when the Boko Haram used to kill people, then they used to kill only men. As they used to kill only men for the first time, we run away. After, they come enter, both the women. They come scatter everybody, killing people. That's why I say we have to come back to Lagos with my family.
Here, there are no camps or structured homes. A room apartment leased out to them by Good Samaritan in the area goes for 500 naira per month. They accuse government of neglect and discrimination.
It's better for us to send the women back home than for us to be here dying in hunger. We cannot pay school fees for our children. Some of us has 2, 3, 4, 5, 10. No school fees, nothing to do with them.
These are internally displaced persons
from northern Nigeria, and these are the uncompleted buildings where they live with their children here in Debojo community in the Bejuleki area of Lagos. We're told that many of them have died owing to the poor living condition in this particular environment.
Succor came their way when a group of individuals visited their community accompanied by medical officials.
I really wanted to do something, so I called him and I asked him, what is the one thing that that you guys are lacking apart from food? He then said that medicals was a major issue because not too long ago they had a nursing mother who had died here.
While the authenticity of the IDP camp still hangs in the balance, the internally displaced persons in Debojo community have vowed to return to their war-torn homes and would rather die there if government refuses to lend them a hand. Abimbola Agbebi, TVC News, Lagos.
All right, that gives us a twist to the story of, or the plight of IDPs now. Whether the camp is legal or illegal, there are people in there who have, who originally have rights to better condition of living, and they're being displaced by whatever circumstance the others are displaced by. What do you make out of the issue of this camp is illegal, this camp is not legal?
No, I think first, let us change the narrative.
Okay.
We are looking at inequality, period. And we are looking at a situation where the state is complacent on its responsibility to the Nigerian citizen. And we as citizens, we are also not engaging the state on the basis of accountability for citizens' welfare and the good of our country. So all of us in the mix have a problem. What you are seeing is not a camp, so you cannot say a place for internally displaced persons. You are looking at an urban slum. And I'm sure if Governor Ambode or any member of his cabinet is listening this morning, they will agree that even in their document for development, they have admitted that they have more than 100 urban slums in Lagos. Because we have been engaging with government in the last 3 years. We did the first study in Uwem, an urban slum that houses the University of Lagos. And when we found 500 out-of-school adolescent girls, we called the Director Agency for Mass Education for Lagos State that we have a problem on our hands.